Hi, my name is Holly and I'm here to talk to you guys about my clinical exercise management plan. So here we have the patient. She's female, 17 years of age, and she's been diagnosed with cystic fibrosis. Looking at her medical history, we can see that she hasn't had her lungs replaced, which means that her forced vital capacity is currently still above 30%. However, we wouldn't really expect this to happen in someone so young. Bone fractures, she's had none, which is normally quite common in cystic fibrosis patients, and this is normally due to the late puberty. We can see that she's had repeated chest infections, which enables us to hypothesize that she's probably been bedridden in a hospital setting for really long periods at a time, which can obviously have huge ramifications, both physically and psychologically. And no history of inflamed pancreas. So normally those who are diagnosed at birth will actually experience pancreatitis. Diagnosis, so she was diagnosed via neonatal screening, which is where they take a small prick of blood from the baby's heel. This usually proceeds to DNA mutation analysis, and when the mutation has been identified, the diagnosis will be further tested by a confirmative sweat test. And this is because those with cystic fibrosis generally have a higher salt or chloride concentration in perspiration compared to the general population. Her current medication, obviously we can see that she's had inhaled trombomycin, which is an antibiotic. However, this can normally lead to lung deterioration. Both ibuprofen and corticosteroids are auto-inflammatory medication. Ibuprofen is actually only effective for people under the age of 18, so we can see that is still appropriate for our particular patient. However, the long use of corticosteroids is known to decrease muscle and bone mineral density mass. So it's important knowledge for the development of the exercise management plan. And lastly, we've got multivitamins, which will help with an array of deficiencies that many cystic fibrosis patients actually experience. So generally speaking, teenagers with cystic fibrosis are less physically active than their peers, and there are a number of potential reasons for this. So first, we have to look at the attitudes about physical activity, particularly in adolescents. So those with patients being a teenager, it's actually quite common in both the healthy and the diseased population that physical activity will decrease in this period as a result of puberty. We've also got the lack of opportunity to be physically active is a huge issue with cystic fibrosis teenagers, as they have limited time due to the time demands of managing such a chronic disease. Disease-related barriers, such as being embarrassed about increased cough and sputum production during exercise, and also the discomfort of shortness of breath, have also been reported to discourage sport in teenagers. And lastly, fatigue is a really common symptom for those with cystic fibrosis. So with the patient's age, it may be beneficial to set goals around a particular sport of interest, motivate them to keep up with their peers, and I think most importantly is to make it social, because socializing is a huge part of being a teenager. So by promoting ideas that people can increase their fitness when they go to the gym with their mates or go for a run together could just be a really good way about prescribing or going about prescribing exercise. So what is cystic fibrosis? So it's an autosomal recessive genetic disease, which that means in order for someone to actually acquire this disease, they must have inherited an affected gene from both of their parents. Those with cystic fibrosis often suffer a range of issues, and it can affect many of the body's systems, including the lungs, the pancreas, and the sweat glands. Cystic fibrosis affects the exocrine system by mutation of this FTR protein, which regulates the production of things like saliva, sweat, tears, and the mucus. So the CFTR protein is a channel protein, so it's responsible for the flow of chloride ions across epithelial membranes, which is really important for things like the balance of water inside and outside the cell. So you can see this in the top right-hand picture. So those who have cystic fibrosis, obviously their CFTR protein is not working correctly, and this decreases the ability of water to hydrate the cell surface and causes the mucus secretions that cover the cells to become really adhesive and thick. So this really thick mucus can then obstruct airways in the lungs and lead to breathing difficulties, sputum production, frequent clearing of the throat, and a decrease in pancreatic secretion of digestive enzymes, and it can also really exacerbate infections. So how does it progress? So its effect on the pulmonary system remains a primary cause of disability and mortality in affected patients. However, the buildup of thick and adhesive mucus in the airways can also make the affected patient a lot more susceptible to chronic embryological infections and inflammation. So, and this is mainly due to the cause of things that build up called mucus plugs. So when you inhale bacteria, they can actually get stuck in these mucus plugs, and it can lead to really chronic infections. The body's immune system will then obviously attempt to try and destroy these pathogens, and it does this by initiating an inflammatory response. However, this progressively can lead to fibrosis and damage the airways and end in the development of bronchitis, which is permanent enlargement of parts of the airway. So when this FTR protein is impaired, it can also actually decrease the pancreatic secretions of digestive enzymes, which can result in the formation of tissue fibrosis. Now, this tissue fibrosis can cause the malabsorption of food and cause digestive tract to actually pass partially undigested food, and this can lead to an array of different issues such as abdominal pain, constipation, weight loss, and also diabetic development. Lastly, infertility. So it's been highly cited that about 98% of men with cystic fibrosis will actually become infertile. And this is mainly because of the tube that carries the sperm, called the vas deferens, which I've pointed to, is either missing or blocked. So there's actually nothing wrong with the sperm. It just cannot reach the semen. So this can be fixed with IVF treatment. Women, on the other hand, with cystic fibrosis, so they normally only suffer infertility due to the fact that they're more likely to experience irregular absence periods, and this is mainly due to illness and also weight loss. So the role of exercise, exercise is actually being more commonly used for mucus clearance treatment, and increased mucus clearance can also prevent recurrent lung infection, and this is by decreasing the buildup of these mucus plugs. We've also got both aerobic and resistance training can increase the forced vital capacity, and it can also increase muscle mass, which is significantly important for good posture in order to limit other comorbidities such as joint pain and also excessive kyphosis, which is something that's really quite, it occurs quite often in people with cystic fibrosis. Any type of weight-bearing activity also has the ability to increase the patient's bone mineral density. And again, this is significantly important in patients with cystic fibrosis, as the condition actually decreases the production of bone mineral density, and this is only due to pancreatic deficiencies. So weight-bearing activities can decrease the individual's susceptibility to fractures as well as osteoporosis. Flexibility is another important part of the management plan for those with cystic fibrosis. It is particularly helpful for improving posture and breathing. So when the body has to use the trunk muscles excessively for breathing and coughing, the individual's posture will start to actually be adhesively affected. So paired with pulmonary symptoms of cystic fibrosis, or this coughing and all this other jazz, the chest pressure can actually increase, which can push outward on the skeleton, and it leads to curvature of the spine. And obviously this can be negatively affect a lot of different systems. So overall, exercise is a really cost-effective treatment for families with cystic fibrosis members, and obviously the earlier you implement physical activity into the patient's life, the better their later life prognosis will actually be. So moving on to the clinical exercise management plan, but before I get there, I would just also like to highlight that there's actually really limited sources about intensity, paces, and guidelines for exercise and how it should be performed. At the moment, it's been highlighted of the possible benefits of aerobic resistance and flexibility training, yet there currently isn't enough research or evidence to create any kind of guidelines. So my management plan is basically based off previous studies and what they've found to be beneficial for their cystic fibrosis patients. So first we've got aerobic training. So I think it's really important that the patient partakes in aerobic exercise to improve, rather to probably maintain their forced vital capacity, which is a major determinant of the disease's progression, and to increase their tolerance to dyspnea, which will allow improvements in aerobic fitness and also possible improvements in self-esteem through achievement, which is really important. It's recommended that they perform this type of exercise 3 to 5 times per week, but because this particular management plan will also incorporate resistance training, and the cystic fibrosis patient, like I've said, obviously normally has a really full week involving different therapies and appointments, 3 times a week will still be efficient enough to elicit the desired response. 30 minutes per session, again, is being recommended due to their busy schedule, and the intensity of the session should be about 50% of their peak oxygen uptake, or between about 70 to 85% of their maximum heart rate. And it should be noted that this is a recommendation for people with mild to moderate cystic fibrosis, not severe. A good rule of thumb, though, to measure this would be using the talk test. So if you're able to carry on a short conversation while exercising, this is a good intensity. Here I've allocated running, cycling, and swimming as possible aerobic training modes. However, with her current age, she's most probably possibly going to be participating in community sporting clubs. So one of these sessions could be replaced with a game, as it would still involve high aerobic stress. So obviously not really low intensity games, maybe things like netball or soccer, and also possibly training depending on the intensity. Moving on to the resistance training program that I've created. So we know that she's been using corticosteroids, and this is an inflammatory medication. However, it can still have really negative side effects that can cause a decrease in muscle mass and also bone mineral density. So this kind of highlights that the resistance training is truly going to be like an important aspect of her exercise management plan. So the main goal of this resistance program was to improve the patient's strength, but more importantly, I was thinking endurance, and this is because both of these attributes of fitness relate to fulfilling the activities of daily living, particularly that of endurance, and so therefore it increases the ability to improve their quality of life because they're able to partake in more daily activities independently. I've used knowledge about the correct guidelines to achieve strength and endurance in a healthy population to actually guide the development of this program. So this is the correct amount of reps, rest sets, and resistance. Previous studies have monitored or prescribed the intensity of a resistance training program by suggesting that the patient's heart rate is to maintain to under 55% of their maximum. So this resistant program has aimed to do the same thing. It should be done about 2 to 3 times per week. and should take no longer than 45 minutes. So again, being flexible due to their normally quite chaotic daily schedule. This program represents the first 4 weeks of training, and the following programs would involve pyramiding, so by increasing the amount of resistance and sets, but also decreasing the amount of reps. This will aid with the continued improvements in strength and endurance performance. And these, if you have a look, so these exercises actually have an upper body focus. So while it's obviously important to improve the whole entire body strength, upper body strength, especially of the back, neck, shoulders, chest, and abdomen, have been shown to improve the elasticity and mobility of the chest wall, which would be obviously really significantly important and beneficial for cystic fibrosis patients. Also, if they're going to be performing walking or running exercises for their aerobic training, this will also aid muscle development of the lower extremities, obviously because it is also a weight-bearing activity. Lastly, flexibility training. So flexibility is important for posture and to keep a full range of movement and decrease the chances of injury. So the patient is able to achieve flexibility through a normal stretching routine at home, as well as yoga and Pilates, which have become increasingly popular over the couple of years. Yoga and Pilates have also got an added strengthening component, which is why it may be the actual reason that it's recommended medium of flexibility compared to other different mediums or just home-based activities. Being able to complete some sort of flexibility training 3 times per week has been highly cited to be the minimal frequency for improvements. And stretches should include the lower body, but there should also be special attention similar to the resistance program around the chest, torso, and lower back. And it should be held between about 15 to 30 seconds and start with about 2 reps. And again, so you probably build these things up. So obviously you can go from 15 seconds starting, build up to 30, and also with your reps, start with 2 and build up to 4. And they should cause no more than a mild manageable discomfort. So here on the right of the screen, I've put together 6 different key exercises that focus on the chest, torso, and lower back. And these can be paired with some other stretches of their choice, possibly another 3 to 4, and can be done at home. So we've got some special considerations, actually quite a few for cystic fibrosis patients. So firstly, hydration is a major one. So those with cystic fibrosis will lose more salt through sweat compared to the general population. So therefore it places them at a greater risk of dehydration. So dehydration can cause secretions to actually become a lot thicker and makes airway clearance and breathing more difficult. So therefore it's recommended that they train in a hydrated state, they avoid extreme weather conditions, and also drink a rehydration drink that contains moderate amounts of sodium and chloride. Cystic fibrosis patients are also particularly susceptible to bacterial infections, which I've previously said, so therefore it's really important that they maintain good hygiene if they use the gym. When exercising, it's also handy to have tissues that are accessible, and this is because, like I previously said, exercise helps with airway clearance, so they're going to have probably an increase in sputum production. Nutrition is also really important to be monitored, so we're not dietitians, but it's important to highlight that there's some basic nutritional needs that are going to need to be met when you're starting to perform a bit more exercise. This is mainly because weight loss is not really a common goal for cystic fibrosis patients, as normally, majority of them are generally underweight, or this is mainly due to atrophy and also the higher energy needs comparable to people who don't have cystic fibrosis. So by increasing fat and carbohydrate consumption can actually avoid additional weight loss. We also have to be mindful of incontinence. So due to excessive coughing, many have weak pelvic floor muscles, and this can lead to leaking when performing high impact activities such as jumping and skipping. And lastly, like I've previously mentioned a couple of times on previous slides, it's really important that you take care when adding additional disciplines into the patient's treatment program. And this is mainly so it doesn't become a burden or too onerous, and it doesn't create resentment. So by changing things up a little bit or using different aerobic or changing up the program as frequently as you can. So on to my journal article. So this was actually a journal article written in 1987. It is a bit old, but it is probably one of the major articles that I could find on cystic fibrosis. And like I previously mentioned, there is actually really limited research. Generally also, there's limited research that's quite recent. So the aim of this particular study was to discover whether a weight training program would lead to a significant increase in weight gain, muscle size, strength, and improved pulmonary function in patients with cystic fibrosis. This study contained 6 men and 3 women with cystic fibrosis, and they had a mean age of 25. So they were all post-pubertal. So this is probably one of the limitations of this particular study. The study required 6 months of variable weight training and conducted 3 times per week. And they also included measurements to see if these improvements occur. And these measurements included things such as body weight, anthropometric measures, including chest, forearms, and leg circumference, muscle strength, and also pulmonary function tests. So for the first half of the program, each workout involved a circuit containing both free weight and machine weight exercises. The goal during the initial period was to increase strength and endurance or stamina. So They were thus instructed to use lighter weights that allowed them to complete a higher number of reps, which is something that I also used in my particular program. So I was able to give them a lower resistance and a higher number of reps to try and improve this endurance component. During the final month, there was a change in the workout for each session in order to further increase strength and muscle mass. So the pyramiding technique was used, again, which is something that I also have stated that I would obviously implement after 4 weeks. And they also had an upper body focus, as they believe that increasing the size and strength of the muscles will improve the flexibility and mobility of the chest wall. Hence why I've also had this really dominant upper body focus. Okay, so at the results, so at baseline, these patients had moderately severe cystic fibrosis. And after the program, there were actually significant changes on several outcome measures. So their residual volume and the residual volume total lung capacity ratio improved significantly. But unfortunately, this was actually the only pulmonary functional change that was significant. There was also a significant increase in body weight, muscle size, and strength, with the average increase in body weight about 2.88 kilograms, and strength at a baseline was almost doubled. So I think that's pretty amazing. So in conclusion, their results support their hypothesis and proves that a 6-month weight training program can increase weight gain, muscle mass, strength, and also pulmonary function in individuals with cystic fibrosis. Furthermore, like obviously the changes in the residual volume further support the theory that exercise should be used as an adjacent treatment for patients with cystic fibrosis. And with the small number of self-selected patients and the limited duration of the study, this is obviously a result that needs to be confirmed by longer, more randomized controlled trials over varied weight programs for cystic fibrosis patients. So in conclusion, I just want to highlight that I think that exercise is obviously a really valid treatment for cystic fibrosis patients. Although many journals and cystic fibrosis campaigns advocate exercise, the literature highlights that it's often poorly and sporadically implemented. And also this is probably due to the lack of detail concerning the most appropriate intensities, durations, and stuff like that, and how this can be implemented alongside other aspects of routine clinical support. So obviously there needs to be more research, as there is currently not enough detailed physiological information to prescribe programs of sufficient duration, intensities, and frequencies in which to affect clinical outcomes. Cystic fibrosis treatment and management can be really expensive, thus exercise can be used in conjunction to these treatments to either enhance their effect and also decrease the need of some medication and therapies. So, and lastly, for children with cystic fibrosis, it's really important to get them as active as soon as possible from the beginning of their lives. And this will help slow the deconditioning process, which will then lead to a greater life prognosis. It can also improve their quality of life by increasing their self-esteem and empowering them to participate in physical education and games with their peers on a more regular basis. And obviously this would ultimately enhance their social life. Thank you for listening to my presentation.